Kiford, so my name is Raphael de Souza. I'm a software as a service sales leader, and I'm also an investment specialist focused on Africa. But I also wanted to give you a quick opportunity to introduce yourself. So just, yeah, please, if you could just introduce yourself and tell us a bit more about what you're doing.
Sure. No, thank you so much for this opportunity to chat to you, but more importantly for this great initiative that we have put together. Mm-hmm. My name is Kiford Zimondi, and I work for an organization called Humana, People to People in South Africa. Mm-hmm. I also work as a community member for the International Federation of Humana People to People, because Humana People to People is South Africa is part of a federation of other Humana People to People national associations that work in the SADC region, except Swaziland and Lesotho. But we are also in India, in China, Latin America, as well as in Europe and North America. In South Africa, our national footprint is such that we are in 5 provinces, in Limpopo, Mpumalanga, Gauteng, KZN, and the Eastern Cape, and we implement some 5 models of development programs, ranging from your HIV/TB, non-communicable community mobilization programs, to the elimination of malaria, programs focusing on children, on hygiene, nutrition, sanitation, programs on smart agriculture, food security, also adding in climate change and global warming. And then the last one is what we call preschools of the future, where we are trying to help the children to access ECD in South Africa. And as a federation, we are also implementing similar programs, but in some countries like Angola and Mozambique, for example, Malawi and Zambia, we run vocational training schools, we run teacher training colleges for teachers who go and work into rural areas. Wow. I can say that that's a summary of who we are as Humana South Africa and as the Federation.
Excellent. Kiford, I'm sure you're keeping yourself very busy with all those things. So it's very clear, as a development expert, you're working firsthand with the COVID-19 response team in South Africa. Can you tell us a bit more about your solution to fight the actual virus?
Yeah, I think you can say, maybe just to give a background, that I think, for me, I think it was strategic, is that the immediate shutdown of economies across the globe, unprecedented as it is, it really helped in the fight, and it is part of the solution in a way. That the lockdown, even though it is global, it is also local. I mean, as organizations, as companies, we also had to go into lockdown. But I think what is more important is that period of lockdown, it helped us as humanity to manage, to adapt, and to cope with the virus. Because I think going forward, what is very clear is that we have to have a balance between facing that reality that the virus is going to be with us for a while longer, some may say 18 months or so, and at the same time, economies have to open, people have to start to go to work, and for many people in the communities where we are working, that line between not going to work and going to work has not been there, because we work in communities where people are struggling. They need to survive. They have to look for money every other single day in order for them to survive. So what's critical going forward, in my opinion, is this whole whole idea to be together with the people, to understand the situation where they are, so that we are able to, educate, inform. Nobody wants to get any disease. I mean, that has also been the history in our experience in the fight against HIV and AIDS, against TB or malaria, or against any disease as such. No one wants to get sick. But then when you get prescriptions, guidance, they have to talk to what people can relate to. When we saw social distancing, what does it mean to everybody else? When you say wash your hands, what does it mean to somebody who doesn't have access to water? So it is this of all the facts that we know, the scientific things that we know that we have to implement. How do we stand shoulder to shoulder with the people in the community so that they are able to act accordingly and secure that we don't spread the virus, and at the same time we are able to open our economies, because we can't continue to be in lockdown.
Yeah. No, that's very interesting, Kiford. So you've mentioned how things are actually affecting the business. So could you tell me a bit more about, beyond that, how other ways that the virus has actually affected your sector? Just give me some ideas of what you've experienced and seen.
Yeah, sure. I mean, okay, a bit historical. I mean, you can say you can divide the sector into two. Now I'm just talking globally, the development sector. And also not only in South Africa, but also in the rest of the Federation. You can say that you can put our programs into two categories. The first category are essential services. Yeah. So from the onset, we as the International Federation Humana, people to people, we have decided we have to be, or not decided, it's essential. We have to be together with the people from the very word go, whether it is in connection with distributing emergency food aid, or in working with all the other health-related programs, so that they do not fall behind. People who are on treatment for TB, for HIV and AIDS, they still have to continue to be on medication, on the treatment, and people would need basic coping. You find yourself in the middle of an unprecedented epidemic, which is unpredictable. You can plan, and we have never experienced this, that economy is shut down. So there is a lot of worry and panic. So a lot of basic counseling services are needed. So a large percentage of our programs remained as essential services, and within the guide of the National Departments of Health in the countries that we are working, we continue to be together with the people, get information, whether it is from the Department of Health or it is from WHO, put it in a format that people can be able to understand, so that then people are able to survive. And then, of course, the other component of our programs, then which were not deemed essential in the different countries, then they also went into lockdown. So that means also that as a federation, many national associations in the different countries had to cut down on their budgets. But we made, you can say a determination or an effort or a position. We took a position to say that we would want as a federation to emerge at the end of the fight, not to close down, and because you can also feel in many places companies are closing down, organizations are closing down. So we use the relationship and the capacity that we have in the federation and in working together to secure that we support each other and be able to survive, the virus itself.
Yeah, I just want to pick up on that. So obviously, in your experience, you're working on multiple projects, including HIV, AIDS, malaria, TB project, etc. What are the learnings? Because you started mentioning some of them. What are the learnings which can be applied to this COVID-19 response? Of course, it's never happened as such. In the short space of time, I'm sure there's certain things you've picked up that you've learned from that you can share.
Yes. I mean, you can also say it's the same. I mean, when HIV/AIDS came into the scene, you could pick a number of similarities that the impact was the same. You know, people were shocked, people didn't know how to react, and so on. And you can also see that you know, there are some tools that we developed as the federation that we have used in our HIV/AIDS campaigns. We had a program that is called Total Control of the Epidemic, that we started in the era of HIV and AIDS. I mean, it's still with us. The rallying ethos around the total control of the epidemic was that it's only the people who can liberate themselves from the epidemic. And that statement is true today as it was then, that in order for us as humanity to win against the epidemic, it is only the people, is the individual person who has to take a determined and a defined stand against HIV, against COVID-19. And we developed a decision-making tool around that. You know, that takes steps. Number one, do I have the basic facts that I have to know? Not the large scientific, you know, the virus came from a laboratory, where did it come from? Basic school fact that a person should have, number one. And then, do you know how to protect yourself? Number two, what are the steps so that people know in more detail? You wash your hands with soap and water for 20 seconds. You know, help people to understand what is 20 seconds, and in the environment where people don't have water. In Angola, Guinea-Bissau, Malawi, and Zimbabwe, for example, we are introducing tippy taps where people can make their own tippy taps so that they are able to create access to water so they can wash their hands.
Just on that, no, I want to pick up on that later on. But I just wanted to get a question in before. You know, in your opinion, how do you see digital technology as being one of the key weapons in fighting this virus in Africa?
Yes, I mean, I think we should leverage cell phone technology, for example, because I think in Africa, if I'm not mistaken, there's over 90% penetration rate of cell phone technology, where around 50% of them are smart cell phones. And the fact that we have got that technology in almost every home, I mean, if not everybody in the house is owning a cell phone, at least one person is owning a cell phone. And I think we can leverage that. I can give you a very good example of how we could use that, because I think the government of South Africa, the president and the Minister of Health have really been on point in the response to the epidemic. In this, that, for example, when the president is giving a speech or the minister is giving a speech, the communication teams, they are already on social media. I use Twitter mostly, but as the speech is being delivered, the communication team is already pushing, posters that are tailor-made in local languages, with pictures, and you can immediately, for us who are in the development sector, we were immediately downloading those posters, and then we push them into the social WhatsApp groups that we have. So that then they go immediately to our projects and to our projects to people they interact with. So that way you find that information that has come from the president or the Minister of Health goes right down to everybody who has got a cell phone. That's number one. Number two, there are a lot of very good apps. For example, you could get an app where you can screen, because people are worried, you don't know if I've got COVID, have I been accessed, but then you can go and for a couple of minutes, you can go in and screen yourself by answering questions and get an answer in advice. So I think we can use that kind of technology. And I mean, you could also imagine, this whole process of contact tracing and epidemiological level, that there's a lot that technology is being employed in order for us to be able to move very fast and conquer against the virus.
Kiford, it sounds like you've been very busy and there's a lot of work with you, and I really appreciate this. Kiford, we're just in the last sort of minute here, and we have to stay in touch. Thank you so much for your time. But just if you could just finish off with just a general message around, because this is going out to a lot of people, other of your stakeholders in terms of governments and things, just another message in general, and then just something of support in terms of this initiative, like saying to everybody to wash their hands and in for Africa. That would be great. Just, just that last minute message, parting message would be great for me.
Yeah, but I think my message is this, that as humanity, we have always won. If you take HIV and AIDS, if you take many other epidemics, yes, the initial stages might be heavy. There might be many unknowns, but the spirit of humanity has always triumphed over this, and over epidemics, and I'm very much convinced that we will also triumph over COVID-19. We have to believe in humanity, we have to believe in people, and when people get the facts and they are tailor-made to their situation, there's no doubt that we are going to win. So yes, what we know so far is that we have to wash our hands for 20 seconds using water and soap, and where you can get sanitizers, use sanitizers. We have to learn to put on our masks all the time when we are in public places and places where we can not be able to do social distancing. Otherwise, we have to do the social distancing, and everywhere where we are, keep your 1.5 to 2 meters away from the next person. We also have to continue to take care of each other, screen every time when people come to work, so that those who are not, if you are not feeling well, you have to stay at home. You have to report to your health providers. Yeah, that's what I would want to say.
Excellent. Kiford, are you in for Africa?
I am very in for Africa, and Africa is going to win.
Excellent. Thank you so much for your time, Kiford. This has been amazing. Take care of yourself and God bless.
I'm in for Africa. I'm in it for Africa. I'm in for Africa.
I am in for Africa.
I'm in for Africa.
I am in for Africa.
I am in for Africa.
I am in for Africa.